Okay, hi everyone. Today we're going to go through the cardiovascular system. So this is for your unit Applied Anatomy and Physiology for Exercise, Health and Fitness. So we're going to go through this slide now and see how we get on. So hopefully by the end of this, you will have met these learning objectives. So you'll be able to describe the structure of the heart and their functions, list the order in which blood flows through the cardiovascular system, explain the stages of progression and atherosclerosis, describe the immediate blood pressure response to exercise, describe the effects of different forms of exercise on training and blood pressure over time, and identify the blood pressure classifications and associated health risks. And finally, describe the cardiovascular benefits and adaptations to different forms of exercise. So here we go. So a little bit of revision for you here, and on Shobi there'll be these worksheets. So you'll be able to use these to label them. And I find this a really good way of learning all of my anatomy. So what you have is these unlabeled diagrams, and you will be able to go through and label them yourself. Then you'll be able to look at the answers and then cover them up, relabel them, or print them again and label them again to help you revise your cardiovascular system so that you have a better understanding of that when you come to do your exams and just your general knowledge. So here we go. Pulmonary and systemic circulation. So we've got the pulmonary system, which is the blood flow between the heart and the lungs. So it's everything that goes between the heart and the lungs. Pulmonary blood vessels include pulmonary arteries, arterioles, capillaries, venules, and veins. Okay, and then we've got the systemic system. So this is the blood flow between the heart and the rest of the body. So the systemic blood vessels include the aorta, the systemic arteries, arterioles, capillaries, venules, and veins, and the vena cava. So you can see on the diagram here, this is the path of oxygenated and deoxygenated blood through the body and from the heart and the lungs. So the bits on the side are the lungs. Hopefully you're familiar with this diagram. You've got the heart in the middle, and you can see which direction the heart pumps the deoxygenated blood to pick up oxygen from the lungs and then bring it back and then repump it around the body. So here's your labeled diagram of the heart. So if you need to go back to this presentation and look at this when you do your diagram and pause it, you can use this to cover up and help you relabel your diagram. So you can see the red is the oxygenated blood and the blue is the deoxygenated blood. Okay, so you can see the different structures of the heart, all of those things that we just talked about, and which way it is flowing in through and out. So you've got a number of valves inside of your heart, and these basically are non-return valves. So the whole point of them is that they open up, allow blood to pass through them, and hopefully not allow blood to pass back. So you can see that you've got some different types here. So the pulmonary valve is a tricuspid, just means it's got three of the little flaps on it that open up. Same with the aortic valve. The mitral valve is a bicuspid, so there's two there, and you can see it shows a tricuspid valve, just an example down in the corner there. So these, like I say, are non-return valves, so that blood can pass through, a bit like lock gates. They pass through like the water does, and it's trying not to allow it back in, so that the blood is always kind of flowing upstream. Okay, so then here we've got the heart. So now we're looking at the electrical impulses that go across the heart. So you may or may not know, but the heart has its own electrical impulses and supplies, a bit like your muscles in your body. So the heart itself is a muscle, and for that to work effectively, it needs the same electrical impulses that the rest of your body does, but it self-regulates, which makes it a little bit different. So it's an involuntary muscle. It contracts without you having to think about it, which is a good thing. Okay, and it goes through this process. So hopefully I can explain that now for you to make it a little bit more straightforward. And the pulses go out in a wave across the heart. So the first thing we've got is an action potential. So an action potential is what is basically, if you think about it like an electrical shock, all it is an electrical shock. And without that, you wouldn't have a beat of the heart. So it stimulates the fibers to contract. So that action potential is generated in the sinoatrial node, the SA node. And you can see that in the top left-hand corner of the heart, and underneath it's got in brackets pacemaker. So you'll have heard that term pacemaker before when people have one fitted. That's when their own personal pacemaker in the heart the SA node is not working effectively for them. So what you have to do is you have to intervene, and you put your own pacemaker in there that gives this action potential to the rest of the heart. That sends a signal out across the heart, okay? And the action potential is passed from cell to cell across the atria, and the cells of the atria contract. So the atrium contracts, which is those first two chambers at the top. Okay, I remember atria or atrium by it's like the old school name for when you walk into a house, so the hallway or whatever is known as the atrium. It's a posh name for it. So I always think about this where blood comes in, and it's also where the contraction starts. So it spreads across, contracting the muscles. Then the action potential reaches the atrioventricular node, and you can see that on your diagram there. It's the one in the middle, okay? And that sends the signal down the center of the heart to stimulate the ventricles, okay? The ventricular myocardium, which is the muscles of the ventricles. And that then contracts the ventricles. So this is why when you are listening to a heartbeat, if you listen to it through a stethoscope, or sometimes if you listen to someone's chest, you'll hear a double beat sound. You'll hear a boom, boom. And that's because the atrium's contracting, forcing blood down into the ventricles, and then blood is being forced from the ventricles, then back out either to the lungs or to the rest of the body, depending on whether it's oxygenated or deoxygenated blood. So you're hearing that slight double beat. That is one heartbeat, but it's just one section of the heart contracting slightly before because of these electrical impulses. So comes out of the sinoatrial node, electrical impulse spreads across the atrium. Those impulses also hit the AV node, the atrioventricular node, go down the center of the heart and radiate around to stimulate the rest of the ventricular myocardium, which is basically a posh name for the muscles of the heart or the muscles of the ventricle. They contract, forcing the blood out. So here's an exercise that you can do on your own, or if you've got someone that you're working with, okay, and you can explain the role of each of the structures. Hopefully, the atria and the ventricles you're familiar with from level 2, or your previous studies, okay, and you can explain the purpose of these and the valves. Starting at the left atria is the second task. Describe blood flow around the body. So if you understand, starting from that point, how it goes all the way around the body and then comes back, oxygenated, deoxygenated, goes back around, then you're going to have a very good understanding of that structures and the blood flow from the heart. So here we go. Here's the answer to that. Okay, if we start at the top with the lungs and we talk about oxygenated blood, the blood goes from the pulmonary veins to the left atrium, gets pumped down to the left ventricle, pumped out via the aorta to the body. Then it comes back in through the vena cava to the right atrium, then to the right ventricle, then to the pulmonary arteries, back to the lungs to get rid of the waste products, and then to pick up the oxygen. If you haven't and you're not too sure about that path and you need a bit of revision on that from level 2, there's already a video on the YouTube channel that talks about the whole system, okay, and talks about gaseous exchange. So maybe a good idea, if you can't remember, to jump back to that, and I'll put a link to that video up in the top of this video as well, so that you can get back to that nice and easily. Okay, so moving on. So here's a little quiz for you to do, okay? Arrange the blood vessels below in the correct order, starting from the vessels that transport blood from the heart, and then indicate where gaseous exchange takes place. So if you remember gaseous exchange, that's where oxygen comes from the lungs and goes into the bloodstream, picked up in the bloodstream to then go back to the heart. Okay, so that's gaseous exchange. Also, it's the other way around with the CO2 going back into the lungs, okay? Diffusion and diffusion. So arrange these boxes. You can just write it on a separate bit of paper now and see if you can figure that out. Here we go. So arteries, arterioles, capillaries, venules, veins. Hopefully you got that right. And you've got gaseous exchange occurring at the capillaries. Reason being that the capillaries are your smallest blood vessel. So they're small to allow the blood to pass, the oxygen or the gaseous exchange to occur there. So their walls are very thin, allowing that to go through. So now we're on to arthrosclerosis. Now this is what you guys will have heard about when people have got increased blood pressure, okay, and risk of heart attacks and things like that. So it's an arterial condition that's characterized by the deposition of cholesterol, proteins and minerals on their walls. So what happens is, you can see from the diagram there, which nicely illustrates it, you've got your normal artery and you've got blood flow through the artery, nice and unimpeded, no problems there. You can see the second diagram down is where you're starting to get a build-up of the cholesterol, proteins and minerals on the wall, which is narrowing the blood supply. And what that does is that then means that you get an increase in pressure. So eventually, if that continues on the third diagram down, you can see that that blood vessel is at risk of rupture. So plaques rupture and release cholesterol and connective tissue into the artery, and a clot forms around the rupture, which scars, hardens and blocks the artery. Okay, a complicated lesion. So this causes could possibly cause a complete blockage, which means that then the person is in a situation of having a heart attack because they're not getting the blood flow through to the heart, which means that a section of the heart won't get blood supply and potentially will die. So inflammation, also known as the fatty streak, okay, damages initiates an inflammatory response, which is what we have with all injuries. So anytime you get injured, you're going to get an inflammatory response as your instant response. So that's there generally in the body to protect the body from, if it's in a joint, to stop you moving it too much. Okay, but obviously in this situation, not great in our arteries. The deposits are laid down in an attempt to heal the area. Plaque builds up and narrows the artery. And then, like I say, plaque ruptures and release cholesterol, connective tissue into the artery, and a clot forms, which ruptures, scars, hardens, and could cause blockage. So that's arthrosclerosis. So blood pressure. And this relates to what we've just talked about. So impairs define the following terms. What is blood pressure? Again, you may remember some of this from level 2. What is cardiac output? Hopefully you understand that. Total peripheral resistance, systolic and diastolic. So these are all things that we will cover in level 2. Again, if you need to switch back and do a quick bit of revision on those, feel free. So here we've got the answer to what is blood pressure. It's cardiac output times total peripheral resistance gives you your blood pressure. Okay. So what do we need to know as personal trainers? Well, we need to know, one, we need to understand what blood pressure is, which is what we've just looked at. If I flip back, okay, cardiac output, so that's the amount of blood coming out of the heart in one beat. And total peripheral resistance is the amount of resistance on the outside of the artery walls. So what we need to understand as personal trainers is blood pressure classifications. So we need to know when someone is at risk, and if we do a blood pressure test with someone with a cuff, we need to understand what is potentially something that requires a referral, something where we can allow that client to train with us straight away, or whether we need to be asking them to get some referral from the doctor. So at the moment, low would be 100 or less, and 60 or less systolic or diastolic. So remember, systolic is the top number when you do a blood pressure reading. Diastolic is the bottom. Systolic is when the heart contracts, so you'd expect it to be higher. Diastolic is when the heart's in its relaxation phase. So the guidance here is that 100 or less and 60 or less, you should seek medical guidance prior to exercising. They may know about this already. They may have experienced symptoms such as sort of fainting or anything like that if they stood up too quickly. Optimal, 120 over 80, no cause for concern, and exercise is recommended. 140 over 90, it says seek medical guidance prior to exercising. Okay, they may well have been referred to you to exercise. So it might be the case that this has already happened. So they might come to you from there. I suggest, and I'm sure there's some stuff in your manual here about this, that you should pre-qualify with your clients if they know about their blood pressure. Do they have high blood pressure, so that you can head that off at the pass. So it's, from a customer service point of view, it's much better to ask your clients these in your initial communications you have with them. Find out if they've had a blood pressure test recently. Find out if they've been cleared for exercise. And then it saves them coming all the way to you, doing a consultation, and finding they've got to go away again and get something else. If they can do that all prior, then that's fantastic. Okay. You will also experience, and I know this again from personal experience, that if you say 140/90, yes, you should seek medical guidance prior to exercise, or they should. But quite a lot of the time, doctors will say, no, 90, that's fine, go and exercise. Okay, but it's just covering yourself. Stage 2 hypertension, 160/100. Yeah, definitely I want them to see a doctor and be cleared before they come and see me. And severe is 180/100. So complete contraindication to advise a client to exercise. Any medically recommended exercise should be performed with a specialist. Okay, so those are the classifications. So that's what you really need to get your head around and really need to think about in terms of your clients. And if you need that chart inside your folder or something like that, because it's hard to remember all the numbers, that's fine. When you're a trainer, you should have all of these things to your fingertips rather than struggling to remember them and feeling unsure about yourself. It's much better to have it there as a reference guide, and then you can be much more confident when you're speaking to your clients. So normal blood pressure and its response to exercise. So effects of incremental exercise on blood pressure, you can see on the diagram on the left-hand side. So that graph there, you've got your blood pressure charted, and it's got your systolic in blue and your diastolic in red. And underneath is workload in W, which means it's in watts. So you could assume this could be on a bike, treadmill. Any cardiovascular equipment will give you a watts readout. Bike is the easiest, obviously, to see. So as the workload goes up, you can see that their systolic pressure rises, okay, because they're increasing the amount of blood that's pumped out of the heart. So systolic blood pressure rises and goes up in line with exertion. So the harder they work to a certain point, the higher the systolic blood pressure. Diastolic remains reasonably stable, or in some cases you can see a little bit decreases slightly, and then as it goes up even further, the watts load, it then increases a little bit, but not very much. You can see it's pretty much hovering around that 80 line if we're talking about someone with normal blood pressure. So what do you think? What physiological processes are taking place to create the blood pressure responses to the exercise? So have a little think about that. Why would that go up? Why would your systolic pressure go up? Think about what systolic pressure is, and then think about what's happening when you're exercising and the demands of that exercise and how that could work. Go back. Sorry, I thought that was going to have the answer. So your systolic pressure is going to rise when you increase the exercise load because your demands for oxygen are much, much greater. Okay, so as you exercise, your body wants more oxygen. So your blood pressure is going to increase systolically because that's the contraction of the heart. So the heart starts to contract harder to force more blood out around the body to get that oxygen to the working muscles as you're exercising. So the harder it gets, the more blood and oxygen it needs. Okay, diastolic is the relaxation. So that is just the blood coming back into the heart. So you're not going to see a massive rise there. So the reason the blood pressure is increasing is because the load and the requirement for oxygen and nutrients increases. So abnormal responses to exercise. What types of exercise can have an abnormal effect on blood pressure? And what other factors affect blood pressure when exercising? So heavy weight training, you will find have an abnormal effect on blood pressure. Isometric exercise can significantly increase systolic and diastolic blood pressure. Heavy weight training, isometric, the Valsalva maneuver can create an effect in systolic and diastolic blood pressure in an attempt to normalize blood flow following breath holding. So the Valsalva maneuver, if you're not used to this or not, haven't heard of this, this is where if you're going down, say you're going down into a squat, you come down into the squat and you breathe in and you hold. And you hold that breath as you start the movement to come back up because you're trying to stabilize your core. Okay, and then once you start to get moving and you know the squat's complete, you force the weight over, force the breath out. That's the Valsalva maneuver. Okay, so that would create a rise in blood pressure because you're holding your breath. Postural hypertension, a reduction in blood pressure can occur in some clients following quick changes in body position. So this is where I was saying about if you've got low blood pressure, you stand up, you feel suddenly dizzy. Long periods of static standing, that can cause people to faint, okay, drop. And that's most commonly experienced in older adults and pregnant women. Also, long periods of standing also can decrease blood pressure because you're not using your legs to help pump the blood back up to the heart. So long-term effects of exercise on blood pressure. So this is what we want to be telling our clients to encourage them to stick with it, and to encourage them to start exercising. So aerobic exercise and circuit weight training has been shown to reduce or normalize blood pressure over time by an average of 5 to 7 in mild and moderate hypertensive. So we're getting a drop. So actually that's really good. Okay, so you can get someone that's got mild hypertension, get them exercising, and it causes a reduction in blood pressure. Heavy weight training, when used on their own, do not appear to reduce resting blood pressure over time. So heavy weight training, although very, very good for you in lots of different ways, when we're specifically focusing on blood pressure, it's not going to be as effective for us as if we get people doing some sort of cardiovascular exercise. So that's what we're focusing on, something that increases the heart rate, okay, has a fairly consistent level to it, and is going to, like I say, raise that heart rate on a sort of longer term basis. So more than just sort of 2 or 3 minutes, but actually a long-term session. So here's some benefits, and here's an activity that you can do as well if you want to. Make a list of the cardiovascular benefits from different forms of exercise. And if you're in a pair, you could do this and separate yourselves. Make a list of the cardiovascular risks from different forms of exercise. So what about the benefits? What about the risks? If you're on your own, you can do 2 sides of the table yourself. And think about, if you're on your own, think about whether you should exercise or not. Think of some reasons for exercising. Think of some reasons, if you can, against. I know we're going to be keen to get people exercising, so that's going to be tough. But try and think of the downsides and what forms of exercise are going to be the best or worst for our cardiovascular health. So think about some of the training you might do at the moment, or that you see going on in the gym, or in classes, and think what of those is going to be the best for cardiovascular. It doesn't have to be actually focused just on the gym environment. It could be anything else outside as well. Okay, so we've gone through all of that, and hopefully now you can describe the structure of the heart and their functions. So this is the list we had at the beginning. List the order in which blood flows through the cardiovascular system. Explain the stages of progression for arthrosclerosis. So you have those 3 stages. Describe the immediate blood pressure responses to exercise. Describe the effects of different forms of exercise training on blood pressure over time, and identify the blood pressure classifications associated with health risks. Also describe the cardiovascular benefits and adaptations to different forms of exercise. So I hope that's helped you with those things. What I would suggest now is that you go back and you read the chapter in the book, okay, and have a look at that and re-go through that information. There'll be extra little bits in there that we didn't cover in this presentation. So as a good learning check and good habit for yourself, watch these presentations and then go back and read the section in the book and do some of the activities. So thanks for watching, and I will see you in the next one.